We still practice the old-fashioned way.
We do general neurology, so we do all aspects of neurology.
Anything from as simple as headaches, migraines, to carpal tunnel.
Right now we are 5 neurologists, and we have other specialists.
We see probably 100 patients a day.
It's very busy.
And it seems like it gets busier every year.
Practice management now is almost a necessity.
Physicians are not business people.
Performance medical management takes all of the business issues away from the doctor. Performance medical management fits the needs of most practices in existence. It can perform all of the business functions that are a nuisance to the physician and allows the physician to have better interactions with their patients.
Performance medical management is like our back office. So they do a lot of things for us.
They are your partners, they have your back, and they're going to provide the same customer service as you are in your office.
Performance medical management is a good model because it's a very flexible model. You can tailor how much you want to get from them.
This is the contact center for performance medical management. We can receive a call from a patient that's new to the practice.
They answer the phone from PMM directly, and they triage the call and schedule with the appropriate doctor.
We make sure that they have the correct insurance and they have the appropriate referrals.
We actually become the front office for the practice.
They do all our billings and collections.
PMM is very, very good in terms of collecting money from the insurance companies. They're excellent in terms of determining if it's the correct amount.
They verify the coding, make sure the coding is appropriate.
It cuts down on the number of rejections that we get, and that way the money comes in faster.
We review the notes of every physician, every encounter before we submit the claim. That way we can validate the support for the ICD and CPT codes.
Insurance companies sometimes have a tendency to deny payments on certain claims, whether it be their consult or follow-up or testing. And because PMM sees such a large volume, they pick it up very quickly.
A physician no longer has to worry about whether or not the claims are going out properly. They are. So then he can focus all of his time or her time on the patient in front of them.
The beauty of being affiliated to PMM is that your doctors could come to work and just focus about being doctors.
They're very good, and not just the doctor's practice, inpatient and outpatient, but also all of the ancillaries that we do.
We do Botox injections, for instance, and they also help with all that, procuring the medication, obtaining the authorizations, even bringing the medication over, so we don't have to worry about making sure we don't miss a shipment.
Performance medical management has dedicated staff. They are dedicated to you and your care center.
The people at the PMM, very friendly, easy to get a hold of. Anytime you need somebody, they're always there.
I believe that the beauty of performance medical management is that they link with you in your office and they want the same thing that you want.
We've gone through a lot of different billing and collecting services, and this is by far the best.
I don't know how we would practice if we didn't have performance medical management handling all our back office needs.